Traditional medicine should be given a chance in the fight against COVID-19. That's according to Professor Motlalepula Matsabisa. He's the chair of the World Health Organization's Committee on Traditional Medicines for COVID-19. He's now calling on government to be open to alternative solutions. He also says more investment is needed in natural medicine.
Traditional medicines contributed, I think, in the past pandemics like your Spanish flu, like your bubonic plagues. And at the time, we're arguing that people continued to use traditional medicines, and there were actually no vaccines at the time. But also we see that vaccine treatments, whether it is through, COVID treatments, whether it is through vaccines or any pharmaceuticals, they play roles at different, phases of the disease. And we see that, the contribution of traditional medicines could actually contribute in terms of therapeutics, as a preventative measures, where people continue to use traditional medicines to prevent themselves from contracting, the disease. There is no single treatment that cures everything. Whether it is pain, you go to a doctor. You don't come up with one single Panadol. They give you a number of treatments because we know that diseases can't be treated by one thing. We argue the same and say with COVID, vaccines are there, but vaccines are preventative. Vaccines may not be curative. And therefore, even though we say vaccines are there, we have realized that in the past, there was a SARS-CoV-1. We failed to come up with a vaccine for that. There was HIV. We failed to come up with a vaccine for that. And the mistakes that we did was we put so much investment in one treatment option, and then when it failed, there was nowhere to go. And we are saying, let's learn from those mistakes and say, let us not put all our eggs in one basket, but let us open enough and say, there may be other treatment that needs to be supported.